When two surfaces of the bones touch to each other, the pain starts. What allows bone surfaces from touching each other is the tissue, which we call cartilage. And at the last stage, we see the patients in that stage. During movement, the patient's bones start to touch each other. This is the ideal patient for arthroplasty.
Are you a candidate for a knee replacement? Find out here.
If this surface is damaged, I mean the cartilage about to lose, we prepare these surfaces according to the implant. There are some guide during the surgery. And so we cut the surfaces and we prepare for the implant. Then we put an implant over the and also over the tibial side. We prepare also these two sections. So during movement will be performed between these two implants. I mean flexion, extension and also rotational movements will be performed on this implant. But the primary principle, different type, different geometry and also different product implants, but the primary principle is this. This surgery is a successful surgery. We have been performing it since maybe 60 or 70 years. We know that everything wears in time, especially the moving surface. So these inserts are now tend to wear less than the old ones. It is getting better every day. Now we have some different options in the arthroplasty surgery. In especially knee surgery, we have different options. Cannot have to change all of the joint because, of course, this surgery works. The most important thing here is the revision. If we make the arthroplasty surgery in a young patient, then revision risk may occur in 30 years, in 40 years, in 20 years maybe. Also, the requests of the patients are important for us because a young patient wants to move, wants to sport. So we have some different implant options in that kind of patients because we know that in young patients, the beginning of the stage of the disease, we have deformities or we have cartilage loss only one or two parts of the joints because knee is consisted from the three joint surfaces. It is the middle side, it is the front side and it is the lateral side, the outer side. So if we see that the cartilage loss is only regarding one side, two sides of the joints, there are small implants which we can replace the joint without opening all the surface. Normally, this is a knee joint. There is also a bone in front of here. It's called patella, kneecap. So think it as a kneecap. During movement, what you don't see here is the cartilage. Think this as a bone tissue. And in our all joints, the two bone surfaces make a movement together regularly. And the most important thing here is the two tissues do not touch each other during the movement. Because bone is a very sensitive tissue. It is very rich from the nerve. So when two surfaces of the bones touch to each other, the pain starts. What allows these bone surfaces from touching each other is the tissue, which we call cartilage. You don't see here. There is a tissue. Even during the X-rays, people see most of the times two bones and there is a space. It is of course not a space. There is a cartilage, which is not a mineralized tissue. So it doesn't absorb the X-rays. Passes down, so we see a black hole. But when a patient gets arthrosis, this tissue above the bone gets thinner. So the most important thing is you should know, all our patients should know that arthrosis is unfortunately a progressive. It starts to happen and gets slowly. And at the last stage, we see the patients in that stage. During movement, the patient's bones start to touch each other. This is the ideal patient for arthroplasty. Because what is the cause of the pain? As I told you, it is the touch of the two surfaces of the bone. So when we make a covered implantation over the surfaces, then we will allow it again during the movement, the touchments of the two surfaces of the bone. So the pain will gone. This is the best indicator.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.